Hi, friends. Welcome to the Lakeshore Ethnic Diversity Alliance Community Conversation. We started these conversations and have been having them just about every week. It's my hope that the conversations that are taking place will help us find common ground and address racial and ethnic inequalities and inequities that are present in our country. The Lakeshore Ethnic Diversity Alliance, also known as LEDA, can help find common ground. I am Gloria Lara, and I am honored to be the Executive Director of the Lakeshore Ethnic Diversity Alliance. Since 1996, we have focused on dismantling barriers and advancing equity by working to build and sustain more racially and ethnically equitable communities. Our work is done by meeting organizations, educational institutions, middle and high school students, employers and employees, and our communities face-to-face, or lately, screen-to-screen. My hope is that the barriers and inequities that have come to light in such tragic ways are deliberately addressed in a way that respects all parties. And now I'd like to introduce Charisse Mitchell. Charisse currently serves as the CEO of the YWCA West Central Michigan. Their mission is to eliminate racism, empower women and girls, and provide peace, justice, freedom, and dignity for all. The YWCA provides comprehensive domestic violence and sexual assault services to child and adult survivors, as well as prevention programming in West Michigan, all through a lens of inclusion and anti-oppression. Before coming to the YWCA, Charisse served for 9 years as Executive Director for the Center for Women in Transition, now known as Resilience, which serves victims of domestic and sexual violence in Ottawa and Allegan counties. Before returning home to Michigan in 2008, Charisse spent more than a decade working in Washington, D.C., helping to build capacity and improve the systemic infrastructure needed by agencies which serve women and children. So welcome, Charisse. It's a pleasure to have you here.
Thank you, Gloria. Thank you so much for inviting me.
So, Charisse, these are really interesting times, especially for organizations such as ours that focus on eliminating racism. Can you please describe how the YWCA has and is focused on eliminating racism?
Thank you. I'm happy to. First, hello to everyone. And I think it's important for us to remember and recognize that the YW and many other organizations have been rooted in social justice for a very long time. This year, we're actually celebrating our 120th anniversary. So we've been at this for a while. And we are part of a national network that really leans into that mission of eliminating racism, empowering women and girls, and promoting peace, justice, and dignity. I think our roots run deep, starting with, we have a history, the first national president the YWCA, first woman of color to head a local YWCA was Helen Claytor. And Helen Claytor was a Grand Rapidian and a resident here. And she and her family worked very hard to promote the ideals of eliminating racism. And in fact, in the 70s, when the YWCA nationally adopted its one imperative to thrust our collective power towards the elimination of racism wherever it exists and by any means necessary, it was Mrs. Claytor who was leading that charge and a part of that movement. So we have been for a very long time engaged, well before the 70s and in the 30s, being rooted in anti-lynching work across the country and locally really focusing on empowering women through the lens of equity. So as we mentioned, our mission being those three pillars, we've recognized that you can't empower women and girls if you are not addressing the systems, the strategies, the structures that are harming them, that are impeding their growth, that are in many ways killing them. We can't get to a place where we are promoting peace, justice, and dignity for all if we aren't doing the first two pillars, that eliminating racism and empowering women and girls. So today, in addressing issues, particularly of violence against women, domestic and sexual violence. That is one avenue, and that's a core competency that we have. But the other avenues of social justice that we're really leaning into today are starting to address the systems, the strategies, the structures that impede our growth, that act as vehicles of oppression. So one way that we are engaging in that is through public advocacy. And we are very proud, most recently, to be starting to focus on school push-out, recognizing that kids of color in schools are often over-policed, often have multiple barriers that prevent them from being able to access educational resources or to participate in school. So promoting the Safe Student Act, which stands for strong attendance for every student, promoting that in the legislature and getting that passed and working to get that passed and introduced, focusing on those things that keep kids out of school. In the state of Michigan, Black students represent 18% of the population, but well close to 50% of the out-of-school suspensions. There's something wrong with that. So advocating in those spaces is one of those ways that we can focus on eliminating those barriers and eliminating racism at its root.
Great. I'm really glad to hear you talk about that specifically with the children's programming and those issues, because that's we've covered that before in previous conversations. So it's good to know that there are organizations such as the YWCA that's focusing on the legislative aspects of that.
Absolutely.
Great. So as we go along, and so you have the focus on racism, but then you also have a lot of other services, and COVID-19 has definitely affected many of your services due to minimizing face-to-face encounters. Can you please talk a little bit how the YWCA is adjusting to this new reality?
Yeah, so we are not unlike every other organization, every other family in the community where the pandemic hit us hard and gave us opportunities and challenges in serving survivors. So for the last 30 to 40 years, our organization has really honed in on interventions that address intimate partner violence and violence against women and families in particular. So domestic and sexual violence really does, that intervention and those supports have traditionally relied on the ability to be fully physically present with people. And we had to make sure that no matter what was going on in community, that we could in some way, shape, or form let people know that they were not alone. So when stay-at-home orders started to be issued, and there are folks who are still, for public health reasons and for safety reasons, needing to stay home to avoid contacting COVID, that isolation is also often contributing to fear and trauma that they're experiencing if they are victims of domestic and sexual violence. So we had to ask ourselves, how do we be present when we can't be physically present? So in the midst of COVID, we made sure that our emergency services, like our sexual assault nurse examiners, our nurse examiner program providing rape exams for survivors, and our emergency shelter for people who are fleeing domestic violence, that those services never closed. They were in person, they're still available to everyone. But all of those other supportive services, counseling, legal advocacy, parenting time, all of those things, we immediately moved virtual. Even our sexual assault support groups, our domestic violence support groups, being able to be present and supportive with survivors who may be involved in court. And a lot of those court proceedings are now happening via Zoom. We are still connecting with survivors, providing advocacy, safety planning, all of that. So we immediately had to pivot to all of these safe and accessible video platforms by phone, by Zoom, any ways that we can be where people need us the most. It's been challenging, but we wanted people to know from the very beginning, even if you are at home alone, that you are not alone, that we can be there, be present, work with stakeholders in the community, because we recognize things like schools where they're kind of conduits to some social supports were not available to people. Even libraries were closing. Businesses were not bringing employees back necessarily. Churches were not offering services in person. So those kind of natural connection points that people have in community weren't always available to them. So how could we build connections with them and let people know that we are fully present, fully available, and that hasn't changed. Our 24-hour helpline has always been available, and people have been using it, and we've seen the increases in the request for services or the request to connect. So that tells us that the word is out and that people are reaching out for services, and that we can be there for them is a great opportunity for us.
Well, great. I was looking at your website, and what I think is really interesting is you had that quick escape button on just about every page. Can you talk a little bit about that one and why you have that?
Part of the reason we have that is often when survivors are reaching out for services, that can be threatening to abusive partners. Part of the tactics that they often use is to isolate people from supports. And we know that for domestic violence survivors in particular, sometimes the most dangerous time for them is the time they've chosen to reach out for services or may in fact be choosing to leave that abusive relationship. So when you are searching for resources, abusive partners may be trying to track what resources you're looking for. Who are you talking to? Who are you connecting with? So as people may be accessing our website for support, we wanted people to know, please hit that quick escape button if it is unsafe for you to be searching for support with partners looking over your shoulder or accessing your phones, your computers, checking out your search history. So we are always trying to be cognizant of when people are reaching out to us, it's not always necessarily safe for them. So what can we do to make that call for help as safe and quick and meaningful as humanly possible?
Great. Let's go back to a previous topic. Talk a little bit more about, the programs that you have with, I don't know if you have them with children, but to really focus in on what you find with the schools and how the disparity in treatment and discipline between white children and, BIPOC or children of color.
Absolutely. So, I mean, one of the things that we recognize is that BIPOC folks across the board, but children in particular, sometimes in families, are often at the bottom of every social determinant you can imagine, whether it's maternal infant health, educational outcomes, speaking to the disciplinary actions and the disproportionate discipline, kids of color in schools, wage gaps, food insecurities, access to safe and affordable housing, the overrepresentation of kids of color in child welfare. There are so many determinants where we find BIPOC folk at the bottom that we had to find and are trying to pay attention to all of those access points where data is really important, where we can find those systems, those strategies, those structures that are creating these inherent barriers to people. To be at the bottom of all of these indicators has got to tell you something. It's obviously not something that is inherent to being a person of color. It has a lot to do with the systems that are set up to support us, that are either doing well, maybe failing, where there are gaps in that. So education was a natural point for us because we see a lot of kids in families where intimate partner violence is there, and kids who experience violence in the home are already entering school with a tremendous amount of barriers. So we can address the interventions and supports for them on one end, but what are other aspects that are impeding kids' ability to be kids? And sometimes they are the strategies, the structures, the policies that are happening in schools. And kids spend more time in school than they do at home. So if we are caring about their growth, their development, and how they are being nurtured and supported, we need to be paying attention to what the environment looks like in schools and how can agencies like ours connect with those support systems and let educators be educators, and how can we wrap around all the other services and supports that kids need to thrive. So knowing that so many kids are impacted, there's a way for us to get at roots so that kids grow and thrive and engage in and raise healthy families of their own.
Great. Can you share with us a little bit about who your outside collaborators or partners might be, particularly in this area?
Absolutely. Thank you for saying that, because I'd be remiss if I didn't say that, particularly around the Safe Student Act, that was really an outgrowth of a partnership with other YWCAs across the state of Michigan. So we had an opportunity to say collaboration is often a greater path to change, across jurisdictions, across the state. And we had found that we hadn't often partnered with other YWCAs, and there are 5 in the state of Michigan. So we had conversations about what is an issue that we can all rally around. We have different programs and services, but serving kids and people and families of color are a part of all of our service areas. So what's something that we could kind of wrap our heads around, wrap our arms around? And this particular issue of over-policing of kids of color in schools, the lack of access to educational supports that may be present, the suspensions and the disciplines that are happening disproportionately to kids of color, and the connections and the ways that policies and data can be changed to better support them, restorative justice practices, things like that, was something that we all agreed we could spend some time on and really have some great change opportunities for us. So other YWCAs having conversations with jurisdictions and school systems, so GRPS, Ken ISD, and lots of community partners that just have an interest in kids and kids of color thriving and learning and growing in an environment that affirms them.
Great. And if I can't remember, was this act passed or not, or is it still waiting?
It's been introduced, and we've said, of all times to try and get something passed in the midst of everything that's going on,
Right.
But it was definitely worth a shot. So there are a number of legislators who were happy to sponsor, co-sponsor, support. So we'll be paying attention, and hopefully there will be time and energy focused on this particular act, as we are all looking at what back to school means for kids. So just because kids aren't in school physically doesn't mean that we shouldn't be paying attention to barriers or access points or launching pads for kids of color. We want to make sure that no matter what back to school looks like, kids of color are not left behind.
Great. And if someone felt really passionate about this particular act, they should contact their local representative?
Absolutely. On our website, there is a fact sheet about the act itself. So if you want to know more about the elements that are in it, and there's also resource information, you can contact our policy analyst, Adrienne, who's been doing phenomenal work in this area. So she can educate everyone about what's in it and what's not, but also who in their, among their representatives can they contact so that they can speak into this as well.
And I'm hoping that this is a bipartisan issue, not just.
Yes, exactly. And we are pleased to see that there is bipartisan support for it. Yeah, because this is certainly something that crosses all aisles. This is about our kids.
Mm-hmm. That's why, you do the work that you do. Why we did the work is because we're hoping that the future is a much brighter future in the way that we envision it.
Absolutely. Being able to connect with and learn from and work with, collaborate with LEDA and other organizations is probably the only way we are going to move the needle forward. If nothing else, in this period of social distancing, we realize now how much we all need each other. And in the period of heightened attention on systemic and institutional racism, I am thrilled to see organizations from all over the place, whether they're 501c3s or community-based neighborhood organizations, or just random people who are lending voice to a problem that's been there for a long time, but we are seeing how pivotal it is now. I am just thrilled to see that work. And the more we talk about it, the more we can do something about it.
So I just put up on the screen, so it's covering the bottom part of our faces, but your website, and I'll have that going up a little bit later. So
no, thank you. That's really helpful. So we know that we are known as an organization for focusing on domestic and sexual violence, and we are thrilled to do that, but we are recognizing probably now more than ever the intersection between racism and other forms of oppression and violence is clear, is strong, and we need a lot of support to address that. If you're talking about policing in communities, what that means for communities of color who are survivors of domestic and sexual violence may be very different, is complicated, but we ought to be having voice and speaking into that. So our ability to communicate with our partners in law enforcement is really important. We can say, we work with you, we need you. We also need you to be affirming, supportive, respectful, safe partners for communities of color.
So speaking of communities of color, can you share with us how COVID-19 has affected safe environments, particularly for women and children in our communities of color?
It's been tough. One of the things that we've recognized is it's interesting to watch the definition of essential worker really evolve. I think before, first responders and have always been essential workers, but we have a new lens of essential worker, those home health aides, those who are working in factories and in manufacturing, who are in gig economies as drivers, as delivery folk. There's a large number of people in those frontline jobs, often low paying jobs, that are people of color. And so they're being hit in multiple ways. Communities of color, Latinx and Black communities in particular have been hit really hard by COVID. They're also the ones who are raising families, being called back to work and having to make some really difficult choices. And so seeing the overrepresentation of communities of color in COVID cases and hospitalization, and in some cases mortality, as well as the unemployment that may be happening. People are being furloughed. So there's an economic impact as well as a public health impact that's hitting people kind of in double ways. And knowing that when there is a downturn in economies, vulnerable populations are often hit first and recover last. So as we talk about bringing Grand Rapids back, bringing West Michigan back economically, we want to make sure that communities of color are not lost in that. We certainly need businesses to come back and thrive. And we also need those who are keeping those businesses going to be able to thrive and be safe and healthy as well. So increasing access to PPE equipment for workers and individuals, those who may be facing economic hardship, how can we provide assistance so that they aren't left behind?
Great. I mean, those are things that, like you said, we hadn't really thought, who really is an essential worker without the people helping us and delivering things to us who aren't, who can't go out. The grocery stores, I mean, it's really, I think it puts a whole new light on who we depend on, particularly in times of crisis. And like you said, there's just disproportionately lower income people of color. So
yeah, I've often wondered where those who, migrant farm workers and migrant workers, how are they being impacted by all of this? Because they're the ones who are keeping food on our tables. And right. If we are not providing supports, access to healthcare, ensuring that if they've got kids, that their kids are safe in school and out of school, we can't address economic growth if we aren't paying attention to the very people who are often holding our economies together, that we often take for granted. And it's time we start paying quite a bit more attention. In my mind, if people are essential, we should be paying them a living wage.
Yes,
and if we're not doing that, we've got some work to do.
Mm-hmm. You mentioned briefly some of your parenting sessions or classes. Can you share with us a little bit more what that is?
Yeah, so I apologize if I misspoke. They're not parenting classes, but it is supervised parenting. So those who have court-ordered supervised parenting time with their kids, we're the ones providing that safe environment for that to happen, providing the monitors who are supervising those sessions. So if there has been some degree of intimate partner violence in a relationship, but there is still, and there are children involved, courts and others may determine that kids have a right to have safe interactions with their parents, even if there are disputes amongst them. So how can we provide safe interactions for parents? So it's parenting time that we're providing, safe parenting time, not parenting classes necessarily, but we are thrilled to be able to do that. There are cases when people have exchanges that they need to do. So one parent has visitation over the weekend, And so where's a safe place for that to happen so the kids are safe, where parents are safe as well. If mom is a victim of violence or is suffering from stalking and intimidation from a parent, or vice versa, how can we provide a space where kid can go from mom to dad or dad to mom without any threat to safety for either the parents or the child?
Great, thank you for clearing that up.
Yeah.
So we're getting close to the end of our time, but are there any parting thoughts or that we didn't talk about that you'd like to share with us?
I think the fact that in the midst of periods of social distancing, we have the ability to reach out and connect to each other, sometimes in some creative ways. So if you know of families where are you concerned about a neighbor, reach out to them, let them know that you're there, that you see them, that you hear them, that you can be present for them, that there are resources out there to support them in their own communities, whether it's in Grand Rapids with the YWCA or Safe Haven Ministries, or in Ottawa County with Resilience, or in any other places. There are so many organizations that are here to support, but also recognize that we are in such an interesting time of public health being threatened and redefined in many ways, whether it's through COVID, the heightened awareness of domestic and sexual violence and how people can be further isolated and left alone and not have access to the supports that they need. They need our neighbors, our friends more than ever, and to not lose sight of racial justice as a critical element to our public health. If we are not paying attention to those strategies, those structures, those policies that continue to oppress systemically communities of color, then that is as big a threat to our public health as COVID.
Exactly. You did mention healthcare professionals. Can
Yes.
you share a little bit about what was going on, or what is still going on with your healthcare professionals during COVID? I mean, because people don't really understand, most people, the service that you offer in that area until they really need it. And
Right.
I think it's really important that people be aware of that service.
Thank you for that. That's really helpful. So our nurse examiner programs for folks who are survivors of sexual violence, there is a place to go if you are in need of a forensic medical exam. You can certainly go to the hospital and have a rape exam performed, but we can do that at the YW as well, in a private space, in a safe space where it is completely confidential, where you get to decide what happens after that exam. If you choose to contact law enforcement and have the kit turned over as evidence, you get to decide that. We don't decide that for you. But more importantly, it is a safe place to say, we want to make sure that you are okay. We have an advocate that's there as a volunteer to stand with you, to support you, to answer questions that you have. A very specially trained forensic nurse who can perform the exam and make sure that physically you are okay, make referrals to other health services if you need them. But these are health professionals. And in some cases, particularly the nurses that are performing the exam, these may be nurses who are on the front line at hospitals and are continuing to provide support to you as a survivor. They want to be there for you and the partners that we work with. And so they are every day stepping into spaces because they care about you as a survivor, that you have the resources you need to heal, to feel connected, to feel that you are not alone, and that you have a voice when you decide what it is you want to do, what steps can you take to heal, and how you choose to seek justice. You get to decide that, and we want to support you in that.
A common theme among everything that we've been talking about is making certain that people have a voice, that children have a voice, and you're helping provide that voice for them. Would like to say more about that?
Yes, thank you for that. I hadn't necessarily thought of it in that way, but to empower someone is to help everyone recognize that you do have a voice, that you do have agency, that there are no conversations, what's the quote, nothing about us without us, that in any space, whether it is calling for racial or social justice, changing policies in schools. Students have a voice in the schools that they are attending. They should have an opportunity to say, this is what safety means for me. This is what an empowering, affirming environment in schools means for me. So whether it's through our Young Women for Change program or other spaces, we are trying to create as much opportunity for people to say, this is me, see me, hear me. I have value. I have something to contribute to this. My lived experience matters. No matter what degrees I have or don't have, what zip code I live in, this is my community too. And so how do we create space for that really powerful voice? Because the more we include those voices, invite, create space, sometimes step back and make sure that those voices are heard above ours. My voice as CEO of the YWCA isn't nearly as important as the thousands of voices of the people that we serve. So it is my privilege to be able to advance a cause that is meaningful for other people, but I am carrying and standing with, shoulder to shoulder, thousands of people who are often invisible. People often say giving voice to the voiceless. People are not voiceless. People have been speaking for a long time about what they need and what's meaningful for them. Quite often as a community, we don't always listen. This is our opportunity to listen.
Great. That was well said. Thank you. And I was just about ready to, finish and do some parting words, but you mentioned a program which really intrigued me, your Young Women for Change program. Can you just share with us what that is about and maybe a success story with that?
Absolutely. So part of the legacy of Mrs. Helen Clater, empowering young women was so important to her and making sure that there is a place and space for them. So we did create what is now called the Young Women for Change program, and it's really designed to create space for girls or people who identify as female to come together as middle schoolers and high schoolers and say, this is the world we want to live in. These are the areas where we want to see change, and we think that's possible. People often talk about Young Women for Change as a leadership development program, and that may be part of it, but that name often suggests, a girls' leadership program suggests that leadership isn't already there. And so I think there are strategies, there are thoughts, there are ideas, there is energy that these girls have that far surpass what we have. They are much more creative, much more intentional, much wiser than we often give them credit for. So it's almost a way for us to step back and say, you tell us what the world needs to look like and what we can do to support your creation of that world. So if adults are getting in your way, if the systems and strategies that adults have created are getting in your way, let us know what we can do to remove them, or tell us to get out of the way so you can remove them yourself. But you have the ability as young people to make tremendous change. So they are speaking to local policymakers, they're speaking to media, they are assessing problems as they've defined them and creating strategies to address them and building up the skills, the resources to do that. And they're creating peer environments where they can talk to each other about those issues that are most important. So even now in a virtual space, they're participating in book clubs, they are having conversations with each other saying, we can make change in our world today. So let's figure out how we're going to do that. And we're pleased to create place and space for that to happen.
That sounds really, really great, and really fascinating. And I know young women and older girls really are interested in changing things, and they have that capability in them to dream.
Yes.
Is what could it be like?
Right.
And that's really great being able to give them a platform for that, because you never know when that is really going to become real.
Absolutely. So they're addressing things that we don't often think about and don't often think are possible to change. So they have the ability, to your point, to dream. So What does that look like? And what do we need to do to support and foster that dreaming? Because with dreaming comes action, and they're ready for it.
Can you tell us about an instance where they came up with something that you thought was like so totally unbelievable that you hadn't thought of it? That, you know.
I think this is probably from a couple years ago, and I wish I remember this young girl's name, and I don't. I apologize for that. But a couple of years ago, they were presenting on. They were doing some problem analysis, and our coordinator for the program, Julia Rapp, would be able to speak much more eloquently about what the work that these girls are doing. But there was one instance where they were tackling or addressing social issues and had done some problem analysis. One of the groups was paying attention to sexist dress codes. Having dress codes in schools often objectifies, in many ways, young women. And so they were creating this kind of whole campaign and a message around keeping your eyes on your books, not my looks. And what was intriguing for me is I had never really thought necessarily about dress codes and how they objectify girls' bodies. And they were paying attention to that. And not only did they recognize that and knew that it needed to change, wanted to change it, they had created letters that they were writing to their legislators. So when I was sitting in a room with some of them, I asked, as an adult, what can we do? What would you like us to do? What are you instructing for us to change? And one girl, I think she was maybe 13, she said, well, you could write to your legislator and tell them that this is really important to change and this is an issue and here's why. And if you'd like, I've written my own letter and I have the addresses. And so if you would like, she was basically showing me, this is how you write a letter to your congressperson. And I'm happy to share that with you. If you don't know how, here you go. And here's the addresses and here's some postcards. So you can go ahead and take care of that today. So there was this sense of, yes, it must be done. It can be done. I'm going to show you how, and here it is. So I was just intrigued by the efficacy and the agency she already knew she had already done it and was happy as a 13-year-old to show me how to do it. I love that. And I'm inspired by that sense of I can do something and I can do it today. There's really no reason not to. There's nothing stopping me. I just need to get it done. And I was so pleased with the energy, the vision, and the simplicity of it to just do it. Someone do something. And these girls are showing us every day in your voice, in your writing, in your work, in your relationships, you can do something to change today.
Wow, that's it's pretty amazing. Did anything ever come of that, those activities?
I think, I'm sure there were lots of conversations there. There was an example of some of the girls had once that had heard a story about homelessness in the media and was really concerned about the language that the reporter was using and basically suggesting that it was almost objectifying people who were experiencing homelessness. And the girls wrote to the reporter, and to their credit, the reporter not only responded saying, you know what, you're absolutely right. I should be thinking about and talking about people and what they're experiencing. They are not things or objects or irritants in a system, they're people. And she changed her story. I think it was on her online version. So there are people who are paying attention to what the media says and how people are portrayed, and the media is responding. I think that's fantastic. I don't know any adults who necessarily got that level of response and change. It was one girl or perhaps a group of girls who just said, this isn't okay, fix it. And they did.
Oh. Well, Charisse, we can keep talking about examples, but I think we're going to have to cut it short. Any parting words?
Just thank you for continuing these kinds of conversations about ways that we can support and grow communities, strengthen them, and pay attention to those things that impede our growth as people of color, that limit our potential, that do great harm, and knowing that together we can change and create a better community for all of us. Thank you
Great.
so much.
Thanks, Charisse. Thank you so much for being here.
All right, take care.
Hang on for a brief minute after we're done.
You bet it.
So thank you all. So what I'd like to do now is, LEDA, we have a pledge, a call to action, our commitment to dismantling racism. And that is on our website. If I can get that. Here we go. There's our website, ethnicdiversity.org. You can go on there. It's our homepage. It gives 7 specific items that you can really focus on in order to live up to the pledge. So people are starting to sign up, more and more people, and we hopefully should be getting close to over 200 people soon. The other thing is our conversation next Wednesday, August 26th. I will have a couple of special guests, and we will be talking and focusing on the census and why it's so important. I mean, I know you probably all heard the ads or seen the commercials, but it's really, really critical, especially now, to focus on making certain that there is a good count for the census. So thank you again, and we'll see you next week. Take care. Bye-bye.